My name is Dr. Thomas Cornwell. The company is Home Centered Care Institute. The Home Centered Care Institute is focused on expanding home-based primary care nationally to the most complex patients in society that otherwise would not be able to have access to health care. So my biggest challenge has definitely been going from being one of the most experienced house call providers in the country with a huge amount of training to being a CEO with a lot of passion but very little training in this new role. And where I really overcome this is by just bringing in a remarkable leadership team, including a chief operating officer to really manage the day-to-day operations. I also have a remarkable entrepreneurial board that really guides us, that really supports us, but also stretches us and has been a wonderful mentor to me. And this incredible team has led to, in terms of our mission of spreading house calls nationally, to these remarkable centers of excellence, which are at some of the most prestigious healthcare systems in the country. I mean, we're talking Cleveland Clinic and Mount Sinai in New York, University of Pennsylvania, MedStar, University of Arizona on the West Coast, University of California, San Francisco, and then Northwestern here in Chicago. And so we've been able to bring in the top centers who say they see the value in terms of spreading home-based primary care nationally. I think the biggest challenge in home-based primary care and medicine in general is that healthcare reform is changing the payment structure in our healthcare system. Literally, it's changing at 180 degrees from what is called fee-for-service, where you are reimbursed more on volume of services, to what are called value-based payments, where you are paid more based on quality outcomes and reduced cost. And so home-based primary care is a value-based service. We can't do a lot of volume, but we improve outcomes and reduce costs. The problem is right now the healthcare system is 70% fee-for-service and only 30% volume-based care. And so we are dependent on the health system moving forward with value-based payments, and no one knows exactly how fast that is going to come. Something incredible on the horizon is the Independence at Home Medicare demonstration, the most successful Medicare demonstration ever that could become a new Medicare program. The Independence at Home demonstration is a house call demonstration. It's in its 6th year. In the first 2 years, it saved $33 million on 15,000 homebound patients by, again, giving them this wonderful care in the home. It is such a successful program that the Senate has actually introduced a bill for it to become a new Medicare program. The significance of that cannot be understated. There has only been one new Medicare benefit a decade, some that you know of. In 1972, it was dialysis. In 1986, it was hospice. A decade ago, it was Medicare Part D, which paid for medicine for the first time. Well, literally, the new Medicare benefit of this decade could be a house call benefit, and it's 100% paid for by the cost savings that the house call programs generate, no new tax dollars. But the problem is the workforce. If we develop this new benefit, we need to develop house call providers, and that is where the Home Centered Care Institute is so important, to develop these centers of excellence. We're developing these house call practicums where practice managers and providers will be able to come to do a 2-day hands-on experience. And we're developing what we're calling HCCI University, which is robust online education, to create this new field of home-based primary care. So technology actually made the house call go away. In 1930, 40% of all medical care was done in the home, and that went down to 0.5% in 1996. And the main reason was technology. As x-rays, ultrasounds, lab tests became available, you had to go to the office or the hospital to get it. Well, now modern technology is actually bringing back house calls because we can do x-rays and ultrasounds, EKGs, and lab tests right in the home. As an example, this is just my smartphone, and just by holding my fingers to the back of my smartphone, within 5 seconds I can get my EKG up on my smartphone, and I can do this for patients.